Ever wondered why a condition called aspergilloma is often associated with the term air crescent sign, or why pulmonary hamartoma has a peculiar reference to popcorn calcifications? Intriguing, isn't it? Today we dive into the fascinating world of radiology appearances and signs. First on our list is aspergilloma, a fungal ball in the lungs, often seen in patients with a history of lung diseases. This condition is associated with the air crescent sign. This term emerges from the characteristic radiological appearance. Picture a moon-shaped airspace that forms around the fungal ball. This airspace, or crescent, is created when the lung begins to heal around the infection. It's a sign of recovery, a hope in the darkness, if you will. Moving on, we encounter pulmonary hamartoma, a benign lung tumor. This condition is linked with popcorn calcifications. Now don't let the term confuse you. This isn't about your favorite movie snack. Instead, this term refers to the unique pattern of calcification within the tumor that resembles popcorn on a radiological image. It's an unusual, yet remarkable sign that helps in diagnosing this condition. Next, we have pulmonary edema, a condition where fluid builds up in the lungs. This condition gives a bat wing appearance on a chest X-ray. Imagine the spread wings of a bat. The pattern of fluid distribution in the lungs mimics this, giving it its unique name. Emphysema, a type of chronic obstructive pulmonary disease, is associated with a barrel-shaped chest. This term is used to describe the physical changes in the chest due to the disease, where the chest appears larger or rounder than usual, like a barrel. Primary tuberculosis, a highly infectious bacterial disease, is associated with Gons focus. This refers to a small area of inflammation in the lungs, a classic sign of primary tuberculosis. Secondary tuberculosis, a reactivation of the dormant bacteria, is linked with Simon's focus. This is a small area of caseous necrosis, often found in the apex of the lung. Lastly, we have pulmonary embolism, a blockage in one of the pulmonary arteries in the lungs. It's associated with two major signs, Hampton's hump and Westermarck sign. Hampton's hump refers to a rounded shadow at the lung periphery, indicating a blockage. The Westermarck sign is a decreased blood flow beyond the blockage. In summary, radiology appearances and signs are unique identifiers that aid in diagnosing various conditions. From the air crescent sign in aspergilloma to the popcorn calcifications in pulmonary hamartoma, and the bat wing appearance of pulmonary edema to the barrel-shaped chest in emphysema, each sign tells a different story. Similarly, Gons focus and Simon's focus give us insight into tuberculosis, while Hampton's hump and Westermarck sign guide us in identifying pulmonary embolism. Understanding these terms not only enriches our knowledge but also enhances our ability to interpret and diagnose conditions accurately and efficiently. So keep these terms in your